So good morning, and thank you for joining us for this media availability. Hang on, I lost my notes. To go over the Walk Cares program. I want to thank our members of the media for joining us. I'll briefly introduce myself. My name is Jessica Nelson. I'm a media relations manager here at the Department of Social and Health Services. So do let me know if you're having any technical issues during the program. I'll take a moment to introduce our panelists. We have Veghte, Director of the Walk Cares program here at Department of Social and Health Services, Justin DeFour at the Economic Security Department. Then we'll hear from Katie Hall, a family caregiver, and Sawyer Stearns, a long-term care recipient. So we'll have some brief remarks this morning from our panelists, and then we'll have some time for Q&A for members of the media. When we get to the Q&A portion, just raise your hand to be called on and ask your questions. And then if anybody joins by phone, we'll also be able to get to you as well. This will be recorded. You also should have the option to record yourself for your own purposes on your computer. Otherwise, we will post this on YouTube shortly after we conclude. So we'll get started with Veghte, Program Director of Walk Cares for DSHS. Ben?
Thank you so much, Jessica. And thank you for joining us today to talk about the Walk Cares Fund. The program's launch is this Saturday, July 1st, and it's a significant milestone in addressing the long-term care challenges that have devastated many Washington families. Like the rest of the nation, Washington faces a long-term care crisis with an aging population that by and large does not have a way to pay for long-term care. You'll hear today from two Washingtonians with long-term care stories that illustrate a simple fact, that the system of paying for long-term care in this country is broken. 7 in 10 of us will need long-term care, help with activities of daily living like eating, bathing, and dressing at some point in our lives. Because long-term care is not medical care, it's not covered by health insurance or Medicare, and private long-term care insurance is only affordable for the very highest earners. Without Walk Cares, those who need care are forced to pay out of pocket for or spend down their life savings to $2,000 to qualify for Medicaid. Loved ones have no choice but to fill the gap with their own savings or unpaid care, often sacrificing their own financial security to do so. Washington State is the first in the nation to create a solution to this incredibly dire problem, ensuring all working Washingtonians can access a modest but critical amount of long-term care coverage. Here's how it works. Walk Cares is an earned benefit. Washington workers will contribute 0.58%, about 0.5% of their paycheck to Walk Cares during their working years to earn long-term care benefits they can use later in life. For the typical worker making just over $50,000 a year, contributions will be about $24 a month or less than $1 a day. Employers will begin deducting premiums from Washington workers' paychecks starting July 1st, 2023, and benefits will become available July 1st, 2026. While almost all Washington workers, including part-time and temporary workers, will participate in the program, there are some groups that are able to get an exemption. You'll hear from Justin with more detail on that next. To earn a qualifying year toward meeting contribution requirements, you must work and contribute 500 hours per year, or about 10 hours a week. There are 3 pathways to meeting contribution requirements. Most workers will qualify by contributing for at least 10 years without a break of 5 or more consecutive years. That's the same way people qualify for Social Security or Medicare benefits. There's also an early access pathway for workers who have contributed at least 3 of the last 6 years at the time when they need care. And finally, near retirees born before 1968 earn 10% of the benefit amount for each year they work. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they get access to a $36,500 benefit that grows over time. Washington Cares is designed to help you live independently in your home as long as possible with services and supports like professional in-home care, making a loved one a paid caregiver, home safety modifications, meal delivery, transportation, and more. As our society ages, we all need to start talking with our loved ones about how we want to live as we age and how we are going to make it work financially. I hope the launch of Walk Cares helps kickstart these kitchen table conversations while also providing Washington workers and their families with the support they need as they cope with the difficult challenges that come with dementia or other long-term care needs. Back to you, Jessica.
Thank you very much, Ben. Now we'll hear from Justin DeFour. Justin?
Yeah, thank you, and thanks, Ben. So as Ben stated, we here at the Employment Security Department are ready to start our collections on July 1st, which is this Saturday. We have been working diligently to make sure that our employers are able to remit the premiums the same way that they do today with our paid family and medical leave. So no extra burden there. That was really important to us to make sure that employers don't have another report or more burden for them to be able to report to us. So that's ready to go. And as I said, like that's something that will continue. We will continue to look at that and try to refine that to as an agency to make sure that our employers are able to have the easiest path to being able to support their employees. So that's ready to go currently. We've also been working through exemptions, as Ben stated earlier. We have a handful of exemptions still left in our queue to continue to work through. But these last couple of months, we've gotten a real influx of exemptions, and making sure that we're doing everything that we can to assist that customer, to make sure that the customers have the information that they need, but also the exemption information in a timely manner. So we're working through those. I mean, in the last couple of months, we've seen I'd say over 10,000 of those exemption requests coming through for the various different categories that have been added last legislative session. And so like I said, we'll continue to work through those, but we're at the very last little bit of those that came in for the June 1st deadline that we had to ensure that those customers get an exemption by the July 1st timeframe. So like I said, there are daily, those continue to come in, but as we continue to work through those, we're getting fewer and fewer, but we'll continue to work through those and make sure that we are getting that information to the customers. So that's really what I wanted to kind of let everybody know here. And just, just to follow up on that, just a touch, one of the things that we're seeing with the exemptions right now also is an influx of the non-immigrant worker visa applications. So we're really making sure that we can communicate with those customers, making sure they get what they need, as we know, like those kind of timeframes fluctuate throughout the year based on what's going on in our state. So again, that will be a continued effort for us as an agency to figure out how we can best serve those customers and make sure that everybody's getting what they need, while also making sure that we're keeping the Walk Cares Fund healthy. So that's really what I wanted to talk about today, and I will send it back. Thank you.
Thank you very much, Justin. Now we'll hear from Katie Hall. Katie?
Hey, thank you so much. I'm Katie Hall. I work for King County Library Systems. I'm also a full-time mother and a wife, and we are caregivers for my mother-in-law, Kathleen. She was in Detroit, and someone I've known since 15, 16. And when we started to see her health start to fail more and more, her constant falls, she has multiple sclerosis. And there's also sometimes people get confused about dementia and some of the things that happen when people have MS. We are so grateful for a program like Washington Cares, because when we just look at the expenses that we have had as a young family with young children, and then also looking to help my mother-in-law, the difference is about $1,200 a month of what she brings in currently from her pension and her Social Security. And I would just say that it's a lot on families, especially when you're planning for the future, and then you also want to take care of your family members. I think that the funding that could come through Washington Cares, if it was available to us today, what that could do for us as a family is allow us to put like a lift, for example, within our home. That can cost thousands and thousands of dollars, so that she can get from the first floor to the second floor, which would help with so many different things: emotional support, feeling like she's still part of the family, us not always bringing things to her. So I just think that this program is wonderful. Even as a employee, I have definitely opted to pay into this program because it's great for seniors, but it's also great for people who have different health discrepancies. I have a daughter that lives with sickle cell. So something like a lift would be amazing for our family so that when we do have crises with the legs, our daughter could still be able to move around back and forth. So this program is one that I think is very important, and I do hope to see other states take it on. And I'll say this too, for caregivers, it's a lot of work, and you have to make sure that you work in that self-care for yourself, as well as the person that you're caregiving for as well. I'm not sure if you had additional questions for me, but I'm a big fan of the program.
Thank you very much, Katie. We'll have possibly have questions from the media a little bit later. But for now, we'll hear from Sawyer Stearns. Sawyer?
Hi, everyone. Thank you for letting me speak today. I am a person with a disability. So I, at 19, became paralyzed. It was a sudden thing, something that I never thought kind of would have happened, of course. And so when it did happen, that brought a ton of different kind of financial support concerns for my family. As I was 19, and so I was, living with my parents at the time, going to college at home, and really we had to really think outside the box when it came to coming home from the hospital and how I was going to have caregivers or how that even worked. I didn't know really anything about either DSHS or even anything with what caregivers could even do at that time. And so I was able to finally get caregiving, but really if I would have had walk cares in our back pocket, it would have given us so much more of a break for my parents who we were paying out of pocket for caregivers at the time, because I wasn't in the system with it. And it was crazy. And so since then I've been able to go to college, and I got my bachelor's, and then I've just recently got my master's, and I've been able to have walk cares or caregiving during this whole time, which has allowed me to be independent and live on my own. I drive and things like that. And so really the caregivers, though, are here to help with like daily living for me, which has been really a game changer in helping me get to and from classes and just getting up and getting ready. And so I've been fortunate enough to have caregivers. But as I excel and just try to go into my career, I worry about the financial of that and with my insurance. And so Walk Cares is going to be a real game changer for me to allow me to have, some type of secure fund that I can pay for these caregivers, because I don't know how I could be as independent without them. So yes, thank you.
Thank you so much, Sawyer, for sharing your perspective. So now we'll open it up for questions. If anyone, just raise your hand and we'll call on you. And just do any members of the media have any questions for any of our panelists? Okay, well, do any of our panelists have any final thoughts that they would like to share before we conclude?
I don't have anything else. Thank you.
Oh,
I would
actually,
just-
and we
oh,
do
go ahead.
have a question in the chat. I'm sorry, before. So what happens if people pay into the program, but then move out of Washington do they receive the benefits?
Yeah, that's a great question. So we have an oversight body called the LTSS Trust Commission, which has recommended to the legislature to make benefits portable for people who do work in Washington, pay in, and then leave the state. Under current law, you have to be residing in Washington to use your benefits, but that we don't start actually paying benefits till 2026. There's still time to work on that. So our oversight body has recommended that to the legislature. We are working on, as staff, working on ways to make that feasible. We're researching ways to pay benefits in other states. There are logistical challenges to doing functional assessments and then managing claims in 49 other states, but we're working on that currently. The legislature may take up that recommendation from the LTSS Trust Commission in the coming years, but under current law, you have to be in Washington state to use your benefits.
All right, thank you for that. Oh, and a follow-up question. So a similar situation, if you live in Washington and then move away and then move back into Washington, do you get a benefit?
Yes, as long as you're in Washington at the time that you're applying for benefits, then you can use your benefits.
All right, thank you. Is there any, I'm just recalling from something that was mentioned previously, is there any period of time of moving away that could potentially affect whether you receive an entire benefit? Like, is there a period of time that you have to be in Washington consecutively for the benefit to be available?
Right. Sure. So the main pathway for most people is to pay in 10 years without an interruption of 5 or more years. If you worked in Washington and then you left the state, and then you came back 4 years later, you could still keep paying in and earning towards your 10 years. If you were to work in Washington for 6 years, leave for 6 years and come back, then the clock would start over and you'd have to start earning your 10 years again. But if you do earn your 10 years, once you've got your 10 years, if you leave the state, doesn't matter how long you're away, as long as you come back before you apply for benefits, you're eligible. And again, these are all things that our commission and the legislature is aware that they're trying to simplify these things over time. Every year, our commission makes recommendations to the legislature to improve the operation of the program. So they're still fine-tuning things to make it simpler. So one recommendation last year was to get rid of that 5-year interruption rule, so that even if there were a longer interruption, that you could still qualify. So those are things that are still being worked on, but that's how it works currently.
Thank you very much. Any additional questions for our panelists? All right, any final comments from you, Ben, or anyone else on the panel?
Yeah, I would just like to say that with the decline of stay-at-home caregivers, and the need in most families for all adults to be working and earning money to pay the bills, and that on top of the fact that our society is aging, with people 85 and older in our state, the population 85 or older is going to double over the next 15 years. Those two factors together means that families it's a gut punch for families when a care need strikes. They have to balance work, paying for care, and caring for a loved one. It's a challenge, and it's going to become more and more of a challenge in the coming years. And we've had in the past Social Security and Medicare as pillars of retirement security. But the third pillar, which we are going to need in the coming years, is long-term care security, a long-term care insurance program like WACARES. Washington State was the first to do this, but I know California is very close to doing it as well. And there's about 5 to 10 other states who are in various stages of doing the same thing. So right now, WACARES is just another reason that Washington State is one of the best places in the country to live, work, and retire. And I think you're going to see other states imitating what we're doing. And for more than 3 million Washington workers who will start participating in the program this July, they're going to start earning earning their benefits and moving towards having more security and dignity and independence for themselves and their families as they age.
All right, thank you very much. And I'd also like to take a moment to thank the rest of our panelists this morning and our members of the media for joining us. And if you have any additional questions as we go forward on walk cares, you can look at the website. And then also, if you want, you can reach out to me for questions. And have a great morning. Thank you, everyone.
Thank you.
Thank you.
Thanks all. Take care.